The Wireless Professional is today's most advanced electrotherapy unit, offering enhanced ease of use and convenience while saving space and time to optimize patient treatment in motion. To optimize treatment, it is desirable to place the electrodes correctly. One electrode, large or small, depending on the size of a muscle group being treated, is placed away from the muscle belly. It is referred to as a reference electrode. A second electrode is then placed over the muscle's motor point. The Wireless Professional comes complete with a motor point pen to help locate the muscle's motor point. Anatomy books refer to motor points occurring at the junction of the superior third to the distal two-thirds of the muscle. In reality, as can be seen in this example, it is not always the case. Once the electrodes are in place and the desired program has been selected, the pods can be switched on. Pressing start on the control unit commences an MI scan. Scanning the muscle ensures that the optimal pulse width is selected for any muscle. For most programs involving muscle contractions, an optimal warm-up program is provided. After the warm-up, the Wireless Professional commences muscle contractions, followed by a recovery phase. Muscles can be worked passively or actively, depending on the stage of rehabilitation or outcomes required. It is generally recommended that treated limbs are not taken into full extension to ensure maximum comfort. Active work can be done using open chain or closed exercises, and programs comprise of varying lengths of work and recovery depending on the one selected. The Wireless Professional's motor point pen is the perfect tool for establishing the patency of motor nerves as well as locating the ideal placement for the electrodes. However, for the smaller muscle groups, assessing the physiological movement is an alternative. In this example, we are looking to work the shoulder's external rotators. However, we see that we are getting shoulder extension instead. Simply pausing the Wireless Professional and repositioning the electrodes results in our desired outcome. The external rotators can then be worked isometrically using the internal rotators to hold the position. This produces a co-contraction of both the internal and external rotators. Progression can be made by altering the arm's position and introducing active work while ensuring correct glenohumeral joint and scapular positioning. Active work can be progressed by combining physiological movements and further challenging the scapular stabilizers. After each work phase, a recovery phase is provided to ensure the quality of work is not compromised. Proprioceptive exercise is an important component for joint rehabilitation. Using muscle stimulation in combination with balance exercises can be commenced in partial weight-bearing activities and gradually progressed to full weight-bearing exercises. Preparation for high demands can also be started in partial weight bearing before progression to full weight bearing. The work phase on the Wireless Professional is always followed by a recovery phase to ensure optimal workouts. Ankle sprains are a very common injury, and rehabilitation of the peroneal muscles is important in reducing the risk of recurrent injury. Using the wireless professional is a fantastic adjunct in this process. The peroneal muscles can be exercised early in the rehabilitation process without any constraints placed on the affected ankle joint. Muscle work can be started in non-weight bearing, and if desired, eccentric work on the peroneals, everters, can be induced by actively recruiting the foot's inverters. Reduced balance is a common finding post-ankle trauma. By combining the wireless professional with traditional corrective exercises, the outcomes can be greatly enhanced. The increased proprioceptive awareness very quickly allows even more challenging balance demands to be achieved. Abdominal strength is often key to athletic performance, the reduction in risk of low back pain as well as aesthetic appearance. Combining the wireless professional with abdominal exercises provides both concentric and eccentric contractions. This combination optimizes abdominal workouts to ensure maximum results. In addition, the wireless professional has specific programs designed to enhance core control and lumbar stabilization exercises. The wireless professional provides additional resistance to any given exercise with freedom of movement. The combination of active exercise and muscle stimulation provides clinically proven benefits for strength, power and endurance, with the additional benefit of being able to provide pain relief when required. The wireless professional is the perfect training partner. Its only limitation is your imagination.